topic of informative speech, a salty child. Woe to the child that which when kissed on the forehead tastes salty. He is bewitched and soon must die. Northern European folklore used to say this about babies. Back then, any baby that tasted salty people knew was going to die. They just didn't know why the baby died. Cystic fibrosis is a very common disease that doesn't have a cure. Scientists have been studying this disease for years. I want to inform people on how much CF can affect a person's life. A person that has to do many tests to find out if they have CF. There are many symptoms of CF, but since there is no cure, only treatments and drugs are available for a CF patient to take to reduce symptoms. According to Mayo Clinic, cystic fibrosis is an inherited disease of a person's circulatory glands that mostly affects the lungs, pancreas, intestines, and sex organs. The lungs are the most affected organ in a CF's body. The mucus builds up in a patient's lungs and blocks the airways. Mucus keeps the lining of certain organs moist and helps to prevent organs from drying out. When mucus builds up, it is easier for bacteria to grow. With mucus buildup and bacteria growing, this causes repeated serious lung infection that leads to damaging lungs. The pancreas is another organ affected by CF. The thick, sticky mucus blocks the tubes in the pancreas. Because of this, the digestive enzymes in the pancreas don't reach the small intestines. Without enzymes getting into the intestines can't fully absorb fats and proteins. CF also affects a person's sex organs. Men with CF have infertility, and it is harder for women to get pregnant. According to U.S. Department of Health and Human Services, there are many signs and symptoms of cystic fibrosis. One of the first signs of CS. When a parent kisses their baby, the baby's skin will have a salty taste to it. A baby may also not pass stool when it's first born. There are signs and symptoms in the respiratory system that CF affects. The thick, sticky mucus clogs the tubes that carry air in and out of their lungs. There are many effects to this: persistent cough, wheezing, repeated lung infection, and repeated sinus infection. There are also signs and symptoms in a person's digestive system. The thick mucus can also block the tubes that carry digestive enzymes from your pancreas to your small intestines. If a person didn't have digestive enzymes, then their intestines wouldn't be able to fully absorb the nutrients in the food we eat. Some signs and symptoms in digestion are foul smell, greasy stool, poor weight gain and growth, intensive abdomen from constipation, intentional blockage, particularly in newborns. According to the U.S. Department of Health and Services, there are a variety of tests that can determine if a person has CF. The first test doctors normally do is a newborn screening test. Most hospitals have begun to routinely check newborns for CF. The test checks a blood sample for a particular compound that is commonly evaluated in babies with CF. The test is necessary for confirming if a person has CF is a sweat test. And doctors collect sweat from a patient to test to see if it's saltier than most people's sweat. After being diagnosed with CF, doctors tend to take an organ function test. This test helps the doctor to watch the health of a patient's pancreas and liver. The most important test to take after being diagnosed with CF is a lung infection test. This test is very important because CF targets the lungs. This test tells a doctor 4 things: size of a CF patient's lungs, how much air they can breathe in and out, how fast they can breathe in and out, and how well their lungs deliver oxygen to their blood. According to Mayo Clinic, treatments and drugs are used to CF patients to reduce complications in these symptoms. Antibiotics are used to treat and prevent lung infection. Antibiotics may be swallowed in pill form or inhaled in a mist. Mucus thinning drugs are also another drug that can be taken. This drug reduces the stickiness of a person's mucus. Taking this drug makes it easier for a CF patient to cough up mucus, which improves lung infection. Some CF patients wear an inflatable vest. This vest vibrates at high frequencies to loosen mucus. The device makes it easier to cough up mucus. Most CF patients end up having surgical procedures done. The most common procedure is lung transplant. A doctor may suggest this transplant if the patient has severe breathing problems, life-threatening pulmonary complications, or increasing resistance to antibiotics used to treat lung infection. Both lungs are infected by CF, so both lungs may need to be replaced. CF patients may also need a feeding tube. Because CF affects the digestive system, a person with CF doesn't get their proper nutrients. Someone with CF may have to wear a feeding tube at night so they get their proper nutrients. A feeding tube can be put through a person's nose to stomach or surgically implanted. Many symptoms come with when being a CF patient. Since there is no cure, patients rely on treatments and drugs. According to Scientific America, about 5% of white Americans are carriers of the disease. One child in approximately 2,500 of European descendant carries 2 defective copies and has the disease. In the U.S., such numbers translate into about 1,000 new cases a year, and a total of about 30,000 people who live with the disorder today. Cystic fibrosis affects many all over the world. What CF patients have to go through and live with is indescribable unless you have it yourself. Between doing treatments and taking drugs to reduce symptoms, a person with CF has challenges every day.